Good afternoon, everybody, boys and girls, ladies and gents, near and far. This is Genviève, and you are on Genviève TV, your channel for forensic and clinical education. And today I'm coming to you live from Facebook Live because I was absolutely mesmerized to hear in the news an Englishman who was in his senior years and with type 1 diabetes. So as you know, type 1 diabetes is a serious medical condition. Hello. And it puts us at risk. It's a life and death conditions with insulin dependency. And that Englishman was in his senior years, so the risk group for COVID-19, the coronavirus. He was on a cruise ship at the coast offshore of Japan, sorry about my French accent, and was contaminated by the virus and found himself hospitalized with severe pneumonia and immediate respiratory collapse. And what I found to be fascinating is that he described how he immediately, when his respiratory system collapsed and his life began to take a spiral for the worst, he immediately thought of using EFT, emotional freedom technique, and he credits EFT for turning his health around. He ended up staying 30 days in the hospital in Japan with the medical teams constantly caring for him during this condition. However, he described the worst of it being collapsing with respiratory distress until he immediately thought of using EFT, and that's what he said turned his situation around. And I was just so overjoyed to hear that. I've been teaching EFT, emotional freedom technique, in my practice for a number of years. We know now that it's a technique that was developed actually in the mid-90s, in 1995, I believe, by Gary Craig. And initially it was used especially in soldiers returning from war with severe post-traumatic stress disorder, which left them entirely incapacitated. Basically, the brain had learned that certain sounds, certain conditions, certain sights were a critical life threat. And in those situations of life threat, the whole body would go into alert and panic and absolute debilitating stress with a fight or flight mode that would render them basically incapacitated in normal life once they return to their own countries. And nothing was responding. Psychotherapy, cognitive behavioral therapy, psychiatry, even medications were blocked by the brain. I found that to be extremely interesting, how the brain can sometimes block the effect of medication when the brain believes that the stress is a life threat that needs to be addressed, and will block. I've experienced this myself, actually, the brain blocking the effect of anti-anxiety designed to calm in a life threat. It was absolutely incredible to notice. And in spite of all of that, EFT, emotional freedom technique, was the one thing that had finally managed to have immediate lasting effects in those suffering from war PTSD. From that point on, that methodology spread like wildfire and gained international recognition. I've taught it to physicians, to medical doctors who have been using this approach in their practice to help their patients with respiratory conditions, with asthma, which we know asthma is also very often linked to emotional stress, emotional conditions, very oftentimes at early age, in early life, and also for allergies, for headaches and migraines. And so it's gained by now a very, very high level of reputation, even in the medical field. There is a doctor in Germany who was a medical doctor and was teaching EFT to friends and family members, and one weekend, I believe, he was sent a patient and it was on a Sunday. So she came to him with a cold, saying, I need EFT to help me with my cold. And he ausculted her, listened to her heart and her lungs, and found her to have pneumonia, and told her, look, EFT is not going to do anything for you. You need to go to a doctor right away and get prescribed antibiotics. And it was on a Sunday, and the woman refused to leave without learning it. And so he, after much debate, agreed to teach her EFT. And through the course of the sessions, he found out by asking her various questions that the illness, the respiratory condition, was triggered by early life beatings that she had experienced. Very, very often, of course, I keep repeating that, current life issues, including medical conditions, are very often linked to weaknesses in the immune system. In fact, we know that pneumonia is very often a demonstration of a fragility, a frailty, a weakness in the immune system, which was unable to fight the infection, and it descends into the lungs. So with this woman, he eventually practiced EFT with her and was able to completely dissolve the stress on her respiratory system within a few rounds of EFT. She eventually went home, and 2 days later reported to him that the pneumonia she was experiencing had completely dissolved along with her cold and flu symptoms. And so that doctor, that German medical doctor, ended up shifting practice and focusing essentially on addressing childhood wounds with emotional freedom technique. I've taught it to doctors and medical practitioners through the course of my practice here in the Northwest. And I worked once with a physician who had been undergoing 21 years of extreme traumatic sequela following a traumatic event that had literally obliterated her life as she knew it. And she developed severe depression, suicidal ideation, along with symptoms of obsessive compulsive food disorder. She would function normally during the course of her day and then arrive at home at night and begin binging on absolutely everything she could find, whether it was sweet or salty, cooked or packaged food. She would literally be unable to stop herself from eating, and then she would vomit to prevent herself from gaining weight. And she told me, as a medical doctor, I'm perfectly aware that I am causing collapse in my body and my health, and very shortly it will be my life. And yet she couldn't stop. In her case, we did 2 regression to cause, addressing the root causes for the symptoms, for the reasons of the ongoing depression that she was experiencing, the loss of the will to live. And the first one went back way before the adult life trauma in early life, in childhood. The second one, we addressed trauma. And then I taught her that emotional freedom technique, and it stopped her symptoms on the dot, literally. Once she started practicing emotional freedom, that was the end of her obsessive compulsive food disorder. She told me after 21 years of week after week psychotherapy, she understood every side of her symptoms, but was not able to release them until we did regression to cause and until she learned emotional freedom. So many examples. There's a plethora of examples around the world of medical doctors using emotional freedom for stress, for high blood pressure, hypertension, pneumonia, respiratory conditions, allergies, asthma, headaches, migraines. In my practice, I've focused it on teaching it to almost everyone who comes to see me. I recommend learning EFT in case they face a struggle later on in life and I'm no longer accessible, or they have moved or I have moved and life goes on, so that they have an immediate practice that can help them. I've had phenomenal success with it with students on the autistic spectrum, and for a very good reason. The autistic spectrum tends to refuse verbal input and shut down the world around them. And with EFT, emotional freedom, it's simply acupressure. It bypasses the conscious level of the mind. And we've had incredible results helping people with the autistic spectrum symptoms finally regain their peace of mind, their confidence, their wellness, their enthusiasm and ability to function. I've taught it to sales athletes and sales executive, and they find that using EFT before their sales appointment ground them and places them in the optimal, authentic, easy state that they can correspond and have phenomenal successes. It's proved extraordinarily successful with tests and exams. In fact, just recently, one of my students was taking an important exam and found himself with a question that he immediately didn't have the answer to, and he used EFT to place himself in what we would call the flow. Basically, today they call it the flow. It used to be called a trance state or a Zen state. It's basically the state in which you are communing and communicating with the energy of life, with the intelligence, with the information that allows you to sink in and receive the answer. And he found the perfect answer for his question. It was magnificent. We've used it for difficult meetings and review and exams and job interviews, anything that causes you a little bit of stress. And also it's phenomenally powerful for conflict resolution, dissolving antagonism between people. As you know, when you enter a conflict with somebody, the more you try to debate, the more it seems that both sides will butt head, a bit like the sides of a magnet that repel, because there are emotions coming forth at that moment. For each person's their very own valid emotions, and the more you try to debate, the more those emotions push against one another. So I always recommend to people to step away, do their round of EFT, and then miraculously we see conflict being resolved in the blink of an eye, because it basically it restores the flow and neutrality and peace of energy in your own body, in your own half of the equation in the case of a conflict. And therefore you find this immediate ability to reharmonize the interactions, interpersonal conflict, interpersonal relations. I've done it with groups as well. Fascinating result. I wasn't even included in that group, but they were all fighting together. And after a while, the negative energy of the constant fights of that group was beginning to affect me. So as a test, because I always test everything that I do, I practiced EFT on all of them without them even knowing about it. And I kid you not, the next morning I show up and they're all hugging and loving and crying, and it was totally amazing. So, but the reason why I come with you today with this is the realization in the news that people in extreme stress, in extreme states of respiratory distress, which we know is the probably number one risk with the coronavirus, COVID-19, especially for those with immune system being compromised, is the respiratory distress. And we now have examples of people in that state of extreme respiratory distress using EFT and literally turning their health around. So I felt immediately compelled to share this with each and every one of you, to let you know that I teach this in an hour. So, and all of those who've worked with me, you already know it. So know that you're ready, and should anything threaten your health, remember to use it, because sometimes we'll forget that we have some incredibly powerful modalities. So all of you, the wonderful being who have been working with me, who I deeply treasure, cherish, and honor, remember you have EFT literally at your fingertips. For the rest of you interested, I will release a 1-hour product that we are able to download from my website, so you can all have access to a session directly with me, recorded live, on how to use EFT. Once this is released, I will no longer take individual sessions to work one-on-one with EFT. I will direct everybody to download the product. So those of you who prefer working with me directly to have your specific questions answered, and your specific state and your specific struggles and limitations addressed with EFT, go to my website. It's genvièvehypnosis.com, and click on the schedule button. And usually I start with a consultation, because that allows us to prepare the work for everybody that works with me, and then we move on to sessions. But if you only want to work and learn EFT, you can exceptionally feel free to just schedule EFT. It's a 1-hour session. It's very beautifully compact and easy to do. and I'll work with you individually until my product is released, and then I'll direct everybody else to the product so I can focus on developing other products. It's my goal for this coming year, with the situation unfolding as it is, to release more and more products so all of you have immediate access to my teachings, approaches, and methodologies. So a quick word before I wrap on EFT. It's basically a tapping solution. Hi Dennis, Patrick, merci de nous rejoindre, c'est super sympa. Leslie, thank you for joining in. Tony, thank you for being here with me. Daniele, Nicola, Mark, you all make my day. I'm so touched and moved by your continuous support and presence. So very quick about EFT, those of you who have never heard about it, it's very simply an acupressure technique in which we use your own fingers on your own meridian points. These are the same acupuncture points that have been used by Eastern medicine for centuries. And so what happens is the brain scans a situation internally with your health and your body, or externally with your circumstances and your environment. And the brain, very much like a data processing or one of those facial recognition systems used by the national defense agencies, the brain will scan the situation, internal or external, with its database of knowledge accumulated and experiences accumulated through the course of a lifetime, and will establish a diagnostic, basically a diagnosis on whether the situation, internal or external, is positive, negative, or neutral. And in accordance to what the brain decides, it will send the appropriate response chemically and hormonally from the brain to the rest of your body. And that's how the magic of life happens, basically. So when we use EFT, it's when the brain has scanned a negative and potentially life-threatening, but sometimes it can be used very simply for stress, anger, for negative emotions, basically outrage, disbelief, betrayal, all those emotions that are not serving you. And as I mentioned, we can use it for extreme cases of fear, panic, and stress. It immediately calms your central nervous system and your body, allowing your body to then resume its natural flow of energy and its engineering, which is to constantly repair, restore, rebuild, and revivify your life force. So with those pressure, what we're doing is we are taking that outside situation that your brain has noticed, and we're shifting the response from negative stress, fear, tension, anxiety, panic, to a very deep sense of calm, clarity of mind, stable, grounded, settling in your own space with inner silence, inner calmness. What happens, as this Englishman described, is immediately his respiratory system relaxed. His lungs started opening up, and he was finally able to breathe again. And that he credits that for changing the downward spiral that his body was collapsing into, which leads to organ failure. As you know, when we're not addressing pneumonia in extreme cases, it will lead to asphyxia and organ failure and death. And so he credits EFT for reversing that rapid downward spiral that he was into, and allowing his lungs to relax and open, and allowing himself to breathe. So as you all know, with hypnotherapy and hypnosis, we're not licensed medical providers, so we never step in place or in front of your medical team. Always first address your symptoms with your licensed medical providers. Of course, we're here to assist your care with your licensed medical providers when we have their authorization. That's very important to know. And for all other reasons, for conflict resolution and self-esteem, we fine-tune this approach with my research colleagues, with my team, in order to best fit it into repairing early life wounds, because that's really what I believe is at the cause for most of our adult life issues. So the way that I teach it is deeply focused on repairing and rebuilding your sense of self-esteem, your sense of self-worth, your sense of self-acceptance, self-forgiveness, and self-love, so you can truly, rapidly, and permanently, it does repair you, embark on the life of your dreams. So it's a bit of a long video today. So thank you all for joining me. I just wanted to share, because I think it's so beautiful that some techniques that are so non-invasive at all, that are gentle and supportive and peaceful and calm have such a massive, significant, and life enhancing effect on your health and your longevity, your wellness, your peace of mind, and your happiness. So I wanted to share this with all of you. So remember, you can find me on youtube.com/Genvièv TV. Do subscribe to the red box because that helps me continue my message. Basically, if I see that people are interested, then I'm going to continue doing those videos for all of you to help and educate you at no cost. And then for those of you who want to learn EFT directly from me before I release the product, go to my regular website. That's genvievhypnosis.com. And you'll find all of the information on YouTube under the videos if you scroll down to the description under the video. And then I look forward to seeing all of you one-on-one. Remember, I work at a distance, Skype, FaceTime, YouTube, of course, but also Zoom, whatever modality works for you. So you stay in the comfort, safety, and wellness of your own home. And we follow international guidelines and we're all safe. And while at the same time, taking advantage of the time that you have at home to learn new technologies and make yourself safer. All right. So have a wonderful end of week, everybody. Thank you, all of you, for joining. It's such an honor to work with each and every one of you. And I'll see you soon in next week's video. Until then, have a beautiful weekend and stay safe out there. Ciao, ciao.